everyone, and welcome back to our Monday 10-minute trainings. I'm Dr. Rob Van Bergen, and today we're going to be exploring trigeminal neuralgia and the best microcurrent treatments, or a few of them, that we can employ to help this condition. So I'm going to start off by asking the question, what is trigeminal neuralgia? Maybe you're experiencing symptoms of it and you don't have a diagnosis. If you have it, you know what it is. Trigeminal neuralgia is a chronic pain disorder that involves sudden attacks of severe facial pain. This can be triggered from touching the face, chewing, speaking, brushing your teeth. Now, this affects the trigeminal nerve, hence the name. This is the fifth cranial nerve, and it provides feeling and nerve signaling to parts of the head and face. Now, this, for us seasoned microcurrent practitioners, is going to give us some direction as to different treatment approaches that we will take with microcurrent right off the bat. And as I said, I'm going to get into some of those in just a moment here. Now, symptoms of trigeminal neuralgia can include intense shooting or jabbing pain that can actually feel like an electric shock. Remember, your nerves are electric, so if you're going to start feeling those electric shocks, it's because your nerves are dysfunctional. Now, sudden episodes of pain or pain triggered by, again, touching the face, chewing, speaking, swallowing, brushing your teeth, these can be signs as well. Episodes of pain that last from a few seconds to several minutes in these areas of the trigeminal nerve, and I'll show you a picture of that shortly in a moment here. Pain that occurs with facial spasms as well. Now, the episodes of pain from trigeminal neuralgia can last days, weeks, months, or longer. Some people have periods when they experience no pain and then it comes back. Now, the pain is usually supplied by the trigeminal nerve. So it's in areas of the nerve, including the cheek, the jaw, the teeth, the gums, the lips. Less often your eyes and even your forehead can be affected as well. The pain is typically on one side of the face at a time. And it could be focused in one spot, or it may spread out in a wider pattern. This pain rarely occurs while sleeping because this nerve relaxes while sleeping, and the pain can become more frequent and intense over time. Now, when it comes to treatments, there are a few we need to look at. One of the major issues with trigeminal neuralgia can be the sheer discomfort of even touching the nerves themselves. This leads to treatment having to depend on the level of sensitivity that the person may have, as the most effective treatment for trigeminal neuralgia could increase discomfort temporarily and maybe even make it impossible for people to actually do the treatments. So let's take a moment here and look at the different treatments. I'm going to share my screen because I prepared a few slides. I know people always find those very, very helpful. So really quickly, you'll see kind of like this artist's drawing of the trigeminal nerves. You can see where it's kind of branching out, and you have this nerve on both sides of your face. So you'll feel pain typically in these areas where the nerves have branched off most severely. But as I said, it could be one, it could be all of them. It could spread around, but typically it is one-sided at a time. It doesn't mean it won't hit the other side at a different point and kind of alternate between. But let's jump into the actual treatments. So probably by far the most effective and time-tested protocol for trigeminal neuralgia is the 6 points protocol. This is the one that requires direct application on the nerve itself. And this is where it can be prohibitive for some people. I've got my evolution here. Any device with any mode that is capable of dosing and zeroing is going to work here. And typically, we do this a little bit differently than a standard 6 points. So if you're thinking of 6 points from 3 pathways, you don't necessarily have to follow it that way. It's more about just looking at these different 6 points. These are the 6 exit points of the trigeminal nerve. So by hitting these points, we're actually treating each of those points on the nerve and treating the nerve itself. So this is going to be mode-wise 77 hertz in the genesis, 60 hertz in the evolution, and assess 60 hertz in the pinnacle. If you're using the older Pro Sport 3, that's known as relax assess in that device. So I'll turn my device on here, and I'm going to hit the mode button until I get to 60 hertz. Now, you see that the order is numbered of these different points. So we start on the side of the face and we work our way up. And I'm going to just stop sharing just for a moment here so you can get a better view. So you kind of start here, and then you move to here, and then you move to here, and then you move to here, and then you go up on there, and you kind of go a little bit on that angle, and then other side here. So that's your 1, 2, 3, 4, 5, 6, and you're moving through those points. You're going to aim to achieve a dose with on each point. You don't have to take it to a 0. If you have the pinnacle and you want to do the 3 pathways version, you can definitely do that. It just takes a bit longer to do. So hopefully you can see that again there. So you're going to hold it in place until you get a dose, which for the evolution is the blue, and the genesis is the blue light coming on blue stem while you're holding it in place on this point in the right mode that we talked about. So 60 hertz to 77. With the pinnacle, you're looking for that D to appear on the screen. Once you've got the blue light or the D appeared, you move to the next point and you do it again. And that's really as simple as it is. But as you can imagine, when simply brushing the face with the trigeminal nerve flare-ups, where that can hurt, you can imagine applying a probe to those points can hurt. And that's where this next option kind of comes into play. And this is tongue stimulation, which sounds scary to those of us not versed with it already. But this option is probably the safer, yet potentially less effective approach, because we're kind of taking a back door into the trigeminal nerve. This allows the electricity and the sensation to disperse across that nerve. So stimulation of the tongue allows the currents to use the nerves in the tongue to essentially reach the pons in the brain, which is kind of like the bridge of the brain, and spread out to all the other cranial nerves, including the trigeminal nerve. So you'll see that kind of listed here. This is the nerves in the tongue shooting up into the pons area of the brain, and the trigeminal nerve is sitting right there. You can see it's even labeled. So this treatment can be done with any device as well, but you will need a tongue stimulator tool in order to do this. So how do we do it? It's very, very simple. You plug your tongue stimulator in. The tongue stimulator uses the red and the black wires. You've got the 2 pins that you use for the sticky pads. You've got to put both of those in the bottom. And you're going to set the device to 121 hertz if you have a Genesis or an Evolution, or to Sanabio 200 in the pinnacle. You're going to connect the tongue stimulator and you're going to place it on the tongue. You've got to spread these 2 prongs so that one is on either side of the line down the middle of the tongue. I have what they call a geographical tongue, so I don't really have the line, but you're kind of like, imagine there's a line down the middle of the tongue, right? You're going to place the tongue stimulator there. You can close the mouth, and you're likely not going to need to increase the power much in order to feel it at all. You mostly can feel it right off the bat at 1 power because you have a very conductive mouth. Hence, the saliva in the mouth is a liquid, and that is conductive. So for about 20 minutes, you want to run that on there. And this should send the current through the tongue, use the nerves in the tongue to get behind in the back door of the trigeminal nerve, and therefore treat it and reduce that pain and discomfort in that way. This might be the best option to try and get some reduction in a flare-up so that you can then apply the device and do 6 points directly. Now, there are other treatments that we recommend for trigeminal neuralgia, but those are kind of in the video library. This is a great starting point, and this is probably the general best options, one for the sensitive flare-ups and one for the people that are not in a flare-up that are trying to just heal the nerve. These are kind of the optimum treatments and ways to go. So hopefully you found this useful. I know people have been enjoying the slides because they really help make things make sense. So yeah, we'll continue doing that as we move through the training videos. And I'll see you next week for another Monday 10-minute training. Any questions on this one? Drop them below and we'll get back to you. Thanks, everyone. Bye-bye.